If the user is not viewing the entire in-service, but viewing only specific therapies, sections 1 through 12 should be viewed first, as the therapy sections cover only programming. PCA therapy. If the pump is running, press pause. Once the pump is paused, cursor down to New Program and press the Yes key. If a previous therapy was interrupted, you will get an alert that a prescription is in progress. Press Yes to continue to a new program. Then you'll come to the screen reading Enter to select with the left side vertical bar reading New. Use the down arrow key and highlight PCA and press Yes. This brings you into the programming section for PCA. Note that PCA is on the left sidebar. Unidentified is highlighted at the top. Press Yes. Now you'll notice that the PCA therapy mode defaults the dosing units to milligrams. PCA is the only mode that defaults to milligrams. All the other modes default to milliliters. The dosing units can be changed by pressing the No key until the dosing unit desired appears in the field. Press Yes to confirm the desired dosing units. For this in-service, we will dose in milligrams, so press Yes to milligrams. Now we have to set a concentration. We will set the concentration as 1 milligram per milliliter and press Yes. The concentration is taken from the label on the medication container. Now we'll select the administration route. This is the only therapy mode that allows different administration routes to choose from. The route can be changed by pressing No until the desired route is displayed, then press Yes to confirm. We can choose IV, subcutaneous, or epidural routes. The reason we have this is that each route has specific volume constraints specific to the administration route. For example, the same volume infused into an epidural space is not safe to infuse into the subcutaneous space, so there are limitations tied to the administration route. For this in-service, we will choose IV and press Yes. You can enter a loading dose. This will always default to 0. The loading dose is the initial dose that you are going to give a patient before the infusion actually begins, so we're going to leave it at 0 and press Yes. The loading dose is a one-time administration that is going to start at the beginning of the infusion. The next field is the med limits. We already touched on this during the continuous programming. Med limits allows the programmer to set dosing titration limits. For this in-service, we will leave the med limits off by pressing Yes. Press Yes again to advance to the next screen. Bag volume. The term bag volume is simply referring to the medication container regardless of the type of container. We will input 100 milliliter as our bag volume, then press Yes. The next field is the basal rate. The PCA mode allows for a continuous basal rate or patient bolusing or both. For this in-service, we will set a basal rate of 0. Confirm the setting by pressing Yes. The program settings can be edited at any time throughout the therapy as the pain management orders change. The next 3 fields pertain to the patient bolus. When a patient bolus is not ordered, all 3 fields will remain at 0. For the patient bolus field, we will put a small dose in for demonstration purposes. Enter 0.5 milligrams and confirm by pressing Yes. The bolus interval is listed in minutes. This is how many minutes must pass between bolus doses before another can be administered. Enter 10 minutes and press Yes. The next field is the number of boluses per hour. The pump will not auto-populate this field for patient safety. The pump will allow the maximum doses or less. To demonstrate this feature using simple math, I can input 6 boluses or fewer, 60 minutes in 1 hour, a bolus every 10 minutes, 60 divided by 10 equals 6. The pump will not allow greater than 6. When I input 7, the pump will alert and instruct me that is greater than the number of allowed boluses, but I can put 6 or less. So we are going to put 6 and press Yes. The last programming field asks if programming is finished. Press Yes to the Done field, and now we are finished programming.